Everywhere you turn, someone is talking about the cost of health care and how things are changing as a result of the Affordable Care Act. But what do these changes really mean to the millions of Americans and their loved ones who rely on Medicare to cover the staggering cost of hospitalization? Changes are coming which will impact how hospitals are paid, which will inevitably affect how care is provided. In the U.S., on average, 20% of the Medicare recipients who require a hospital stay will return to the hospital within 30 days after being discharged. That's right, 1 in 5 are returning to the hospital in less than a month. Not only does this place an emotional and physical burden on patients and their families, the financial liability to Medicare and other insurance payers is proving debilitating to our entire healthcare structure. Especially when you consider that it is estimated that nearly 90% of hospitalizations are potentially avoidable. To combat this trend, the Affordable Care Act has put measures in place to financially penalize hospitals for readmissions, which occur within 30 days of prior discharge for certain medical conditions. Hospitals and insurance providers will simply not be able to absorb the cost of these repeat stays. Therefore, care will inevitably be rationed, meaning when you actually do need to be rehospitalized, you may not be readily admitted. So the search is on for a way to ensure that patients remain stable and at home once they are discharged from the hospital. While the industry is wrestling with these tough questions, CareCycle Solutions has been busy formulating a solid answer. Through the use of telehealth, they have achieved 30-day hospitalization rates as low as 6.7%. That's less than 1 in 14 having to return to the hospital. In this case, it is not too good to be true. This is not a solution that they think works, or hope works, or might work. It does work, and they have almost 2 million patient days of data to prove it. This is a solution that gets the right results, lower cost, for the right reason, better patient outcomes, in the right place, at the right time. Are you interested in care that keeps you out of the hospital? We have a solution. Find out more at carecyclesolutions.net.